Welcome, everybody. Thank you so much for being here today. My name is Aastha Saggar. I'm a wellness coach. I'm a stage 3 breast cancer survivor, and I'm the founder of Still Strength Wellness. I built Still Strength Wellness because when I was going through my own journey, I had the privilege of having an amazing care team. And I still found that there was a lot of gaps. I found that the day to day was really difficult and it felt like I didn't have the support I really needed. And so, as I went through my own journey, I found the things that really worked for me. I started looking into it. And so, things like movement, nutrition, presence, meditation, leaning on the community, there was so much research to back it up, but I didn't know this during the time. I only found this out this year. And I realized that there was so many ways to actually cope with dealing with cancer, the side effects, the treatment, everything that's not necessarily talked about as deeply. Because of course, our doctors, the care team, they're trying to just help us survive. And that is obviously the essential, and that's the first thing that we need. But there was a lot that was missing that made me feel like, wow, I just don't know how to thrive through this journey. And so, taking all of those elements, I brought that into Still Strength Wellness so that I could help coach others and provide these free wellness talks so that others could also kind of have that, whether they're in their journey, whether you're outside of it, whether you're just a caregiver seeing somebody who's gone through it, these tools are things that you can use on a day to day basis. So today is about unlocking your inner strength through gratitude. And I wanted to do this for a few different reasons. One, it's November, Thanksgiving, gratitude, thought it was very on theme. But also, I genuinely found so much strength and resilience and hope through gratitude to the point where years later, I still see the impact it has on my mental health, my physical health, my healing. And so I really wanted to share this all with you. So I wanted to talk a little bit about the research first. There's a lot of neuroscientists that have found that every thought that we think actually sends a chemical signal through our body. So if we are thinking thoughts of fear, our body's going to flood with cortisol, it's going to flood with inflammation. Versus if we are thinking about gratitude, our brain is releasing so much dopamine, so much serotonin, so much oxytocin. And these are all things that actually really help with bringing forth that healing. So, quite literally, we can sculpt our biology with our thoughts. And I think that's just an extremely, extremely powerful thing. So, I wanted to share a story with you all. When I was diagnosed with stage 3 cancer, it was a whirlwind. Basically, what happened was I was on vacation with my family. We were in Denver, and I'd gotten very into working out, moving my body, and I was on a treadmill. And I was running, and I just felt something weird. I was like, this is a weird muscle strain, not sure where it came from. I wasn't lifting, I was just running. And I kind of just ignored it, saying, okay, the muscle strain will go away. I come back home from Denver and it's still there. And which is weird because once again, I'm not even using those muscles, I'm not lifting. And so my husband just kind of urges me to just check it out. He's like, just in case, let's just make sure everything is going well. And so I go to my primary care physician and she does a check. And although she has a mask on, I can see like the concern on her eyes. Like the energy shifts, her eyes widen, and I know something is wrong. And I'm like, okay, what do I do now? And she sends me across like 30 minutes away from where I was to say, you need to go get this checked out right away. And so I go, I get an ultrasound, I get a mammogram, get all the tests done. When a doctor comes in and is like starts talking to me about how I need to come back in for a biopsy. And I'm still not processing what's happening. I'm 24 years old. And when this happens, I'm like, please just tell I kind of like shut him off and I'm like, please tell me what is going on and why you're telling me to come back for a biopsy. You're not giving me a lot of information. And this doctor was so direct. He looks straight at me with his eyes wide open again, saying, I think you have breast cancer. And I'm like, what? I like feel the blood just like leave my body. I'm like, I came in here for a muscle strain. Like I thought this was just a physical pain I was going to have. So I go home, I tell my husband about this. This is on Friday. I can't get my biopsy till Monday. So I have an entire weekend to sit with this wonderful information. And I'm like, oh my God, how do I get through this? So these 2 days truly felt like 2 weeks. We were just getting through it moment by moment, really just dreading what was to come. I get my biopsy done. And when I get that message, it says stage three cancer. And I'm in just complete shock because I'm in great health. I feel fantastic. I'm working out. I feel like I remember feeling like I had the most energy I ever had. So there was no side effects to indicate this. And so now me and my husband are just spiraling, saying, how could this happen? How do we break this to our families? What do we do? And I get a call from my PCP to just check in with me. She wants to know how things are going. She wants me to help take the next steps to actually make the appointment with my oncologist. And my husband just kind of grabs the phone and he's like, I need to hear some good news. And my PCP says, well, actually, I do have some good news for you. The fact that Asta caught this from a muscle strain while she's running on a treadmill, she's like, I've been in this field for a really long time. I have never heard a story like that. The fact that there was no side effects, that there was no indications, there was a very high chance that Asta would have caught this at stage 4. The fact that you caught it at stage 3, that's a miracle. That line shifted everything for me. I was like, a miracle? And I went from thinking that this is the worst situation in my life, that I cannot believe I have to go through this, to suddenly feeling, oh my God, I'm so lucky. I get to actually have a treatment plan. I get to do something about this. I actually have another day to live. And that's when I realized the impact of gratitude. I was in just complete disbelief of how much of a miracle the situation actually provided. And that was the start of me bringing gratitude into my life. Things were still difficult after. Of course, there was the side effects. I started chemotherapy. I realized how difficult it truly was on the body. And I forgot about this gratitude. And when I actively brought it back into my life, things shifted again. It went from me saying, I don't want to get chemotherapy. The side effects are terrible. There's no point of this, to saying, oh my God, the fact that I'm feeling fatigue right now, it's because the chemotherapy is working. It's because there's something actually trying to get rid my body of this cancer. How lucky am I that I get to be in a position to get treatment, that I can afford it? How lucky am I that my now husband moved in with me 3 days before accidentally? How lucky am I that it's stage 3 and not stage 4? That's the role gratitude played into my life. And that's the role that I think gratitude can play into all of our lives. Your story might be different than mine. It might look different. You might, once again, be a caregiver. You might have a different health condition. You might be in the process of of getting these treatments. You might be post treatment. No matter what stage you're in, gratitude can bring something essential to the table because the brain is wired to be in survival mode. Our brains want to think, how can we survive? And when that happens, we start seeing kind of the negatives in life, right? Of why are we going through this? Why is this happening to us? But when we bring in gratitude, it allows us to shift that perspective of, wow, we have a lot. This is incredible that we get to go through this because we're going to learn something from it. And I think that's really the shift that I want us to focus on today. So I want us to take a moment to either close our eyes or to get a pen and paper, or if you want to write it on your phone. I want you to think about a situation right now that is not going well, maybe a situation that doesn't feel the greatest, and maybe where you're struggling with it. Maybe it's a health concern, maybe it's something else, just anything in your life. I want you to think about it. Think about what's going on, and then I want you to reframe it. I want you to think about where can we get the gratitude from that situation? How can we spin it to see the good in that situation? So let's all take a moment to do that. Once you think of that situation, I want you to reframe it. If you feel comfortable sharing it, please do in the chat, but you definitely don't need to because this is definitely just something I want you to take with you. Let's take another couple minutes. So doing gratitude, it truly can rewire our brains. And I really feel like I was able to witness this during my journey, but actually long after as well. In every situation in life, it became so much easier to see the good in the situation and not feel so reactive. It finally felt like situations and what people were doing was not controlling me, but I got to control things, right? There's a lot, of course, that we can't control. We can't control our diagnosis. We can't, there's definitely certain things in life that we just don't have control over, but we do get to control how we react to a lot of these things. And by practicing that actively, by doing that on a daily basis, it becomes so much easier to then not react to even other things that are happening in our lives. And I really found the freedom and the happiness in that because that meant that I got to choose my peace. That meant I got to choose how I felt versus other people telling me how I should feel, other people kind of controlling what I wanted. And so I want to basically just end this before I introduce Dr. Hemrajani that not only does gratitude allow us to see the good in situations, I also realize that gratitude really helps us see the good in ourselves. Just like we see, it's very easy to see the bad in situations. I think it's just as easy for us to see the bad in ourselves. I feel like we can be very hard on ourselves, kind of see what we're not doing, see what we're lacking. And so not only does gratitude help us change the situation around us, but it's actually helping us see ourselves for who we truly are, to see that inner strength, that inner resilience. And that's truly where I feel like I got the power and I found my strength during this journey was because of that gratitude. I saw what my body was doing for me on a daily basis. It was trying to live, it was trying to heal. I saw all the good that I had, where on my hardest days, I still made it out of bed. It was very easy for me to see all the good that I did. And in similar ways, I want you all to be able to see the same thing, because that inner strength, that inner resilience is in all of us. You all have situations where you did not think you could get through it. Doesn't have to be my story, but there was definitely situations in every single one of our lives where we've had trouble thinking that we could ever get through this, but we did. And I want you to remember that inner strength, that inner resilience is in each and every one of you, and you have access to it at all times. And gratitude really allows us to bring that forward, to bring that there, to really remind us, oh, we are incredible human beings and we have a lot to bring to the table. And I think that this practice will allow you to do it. And so, just like we just did a practice of you seeing a situation that maybe did not seem so good and rewiring it and seeing it in a different way to see the good, that's a tool I want you to take with you. And one way to do that is by doing 3 things of gratitude in the morning when you wake up, thinking about what you have, what the day has to offer, and then either writing or saying 3 things that you're grateful for at night before you go to bed. I found this to be so effective because it's such a beautiful way to end the night, and it's such a beautiful way to start the day. That way, instead of being in a lack mindset, you're in an abundant mindset where you're thinking about all that you have and all that you're excited for. Another practice I want you to take home as well is that reflecting on your day. I feel like if you have a personal diary, if you maybe just journal, something at night to think about your day and think about how it was. I've been using a diary recently to reflect on my day, and I've really noticed so many aspects where I'm not seeing the abundance, but I'm actually seeing the lack. And it's made me so aware that the next day, I notice when my mind is kind of going towards the negative, and it automatically helps me say, "Oop, nope, let's think about the positive. Let's see what I have in this situation." And it's really helped me feel more peace, more happiness, and genuinely just better overall. So I want you all to try that as well, so that instead of the days just going by being on autopilot, you actually get to reflect on your day, see how the day was, notice where you were resilient, because I promise you that you're more resilient than you think as well. And then also notice maybe where you weren't as resilient, but you want to be the next day. And that reflection really allows you to be that person who you want to be the next day, because now you're really aware of it instead of being in that, fight or flight or that survival mode. So we're going to put all this together again at the end. And I want to just have you take that away. So let's just take 1 second to close our eyes and just process all that gratitude. I want us to take a deep breath. Exhale. Inhale. Exhale. I want gratitude to fill your heart. Remember all that we have. I want you to remember who you truly are and how strong you truly are from the inside out. I want you to gently come back. So I'm so excited now to introduce you all to Dr. Hemrajani. Dr. Anshu Hemrajani is a breast oncologist whose compassion and insight reminds us that healing is both science and soul. She completed her training at Northwestern and Loyola, and for the past 8 years, she's been serving patients across North Shore and Chicago. Tonight, we're going to be talking about what healing really means, both from the medical side and the human side. So I want to start us off with how I've shared a lot about how gratitude has become one of the most powerful tools in my own healing journey, but I'd love to hear from your perspective. As someone who walks beside patients every day, what does gratitude mean to you? Not just as a doctor, but also just on a daily life as just being a normal human being.
Yeah, well, thanks, Asta, for the introduction and such an incredible, inspiring story of your own. And I'm happy to be here. It's interesting because when I think of gratitude, I was actually thinking of it in the exact same way that you framed and mentioned at the beginning of today's discussion where, we often hear the analogy of, it's not just a glass half empty, but it's a glass half full. And I heard a quote once where it's not only that, but the glass is refillable. And I think that
Love it.
really carries me through a lot because, as you mentioned, we don't have a lot of control over some things, especially as a cancer doctor. I never have control when a patient walks in with a new diagnosis. And I wish I could take it away from them, but I can't instantaneously. But especially those that have local disease or curable disease like yourself, we can always say, okay, this is going to be a temporary moment in time. I usually tell patients, give me a year, give me a year and a half, and this journey will be behind us, but we just have to get through one piece at a time. But even for our metastatic and stage 4 patients, the glass is refillable that way too. We have new and new drugs and innovations that are being researched and looked at every day. Every conference we attend, there's, tens and twenties of papers that are released with new options and drugs, and people are able to live years now with their diagnoses. And I think it is reframing that while we don't have control over some things, reframing what we do have control over, and how there are some options here. So,
That's so beautiful. I actually have never heard that part that the cup is also refillable. That's such a wonderful way to look at it. And I love that you said that because I remember thinking even when I was doing my gratitude during my journey that I remember feeling like I'm so lucky that I got it this year, like the year that I did get it, because I'm like years ago, I don't even know if there was research that backed the medications up that can like treat me. And so that's really interesting that you say that because that is such a hopeful thing to say because there is always innovations. There are so many things that are coming out that can help us. And that's just a very beautiful way to reframe that. I'm definitely gonna write that down and post it somewhere in my room. I love it.
yeah,
Thanks
yeah.
so much for answering that one. So I want to also ask you, I feel like we often focus so much on medicine and physical recovery, which is, of course, so important, but emotional and mental well-being can have such a profound impact on this journey as well.
Mm.
So, from what you've seen in your work, how does a patient's mindset influence their treatment and healing outcomes?
Yeah, I think it's an incredible impact, fortunately and unfortunately. I agree. As physicians, we often focus on, okay, these are the drugs that will be useful and will be, therapeutic and kind of getting rid of the cancer. Here are a bunch of medications for nausea or for diarrhea or for nerve pain or whatnot that can be a consequence. But oftentimes, I think, the medical field is a little bit behind on some of the other options to kind of add in to a patient's care. And I know a lot of the cancer centers are working on kind of adding a dietitian or adding in psychologic support, social work support. There's more and more cancer wellness centers like yours that are kind of being developed to kind of hack into this unmet need. But I see it all the time when there's a patient that has all those resources. And, most importantly, thinks of it from a positive attitude. I know it's really hard to say to a cancer patient that's going through so much with the new diagnosis and then obviously suffering from the side effects of their treatment to say, just stay positive, right? It's hard for me to say that as a provider because I'm not the one having to go through it. but it does truly impact how they'll be able to get through treatment. Um, Staying kind of active, eating well, those kinds of things will also impact how they get through treatment. And then also their side effect profiles from the treatment. So we see it day in and day out, and the literature, the research supports that. And so we try to encourage that in our patients as best as possible, and try to support them with the tools that we have and that could be available in the community for them as well.
That's incredible. And
Mhm.
do you know like what kind of side effects and things like what have you noticed with the side effects in patients who are more positive versus less? Like have you noticed a big difference with working with them?
Yeah, I mean, I think fatigue is such a interesting side effect because oftentimes it's one of the most profound. That's the one I hear the most often, and yet there's no pill to treat
Yeah.
fatigue. And I say that to my patients all the time. When I get complaints of, I can't get out of bed and I'm so tired, and it's like I can give you a pill for nausea, but there's no pill I can give you to take away that fatigue. And I notice um, things like that being motivated when you're more positive, you're more motivated to, okay, if I notice a symptom, I'm going to go ahead and take something that's going to be helpful for me right away instead of waiting and letting it kind of get a hold of itself, or get ahead of itself, I should say. But yeah, things like fatigue, things like making sure you're taking the supportive care when it's needed is truly helped by things like positivity. And in order to battle that fatigue counterintuitively, the most effective way is moving the body and getting
Yeah.
exercise, getting routine exercise. And that's one of our most, often suggestions for those that complain about fatigue is, I know it sounds counterintuitive, but try to move your body more, and it will work in your favor.
Yeah. I love that you said that because I feel like I didn't know that and I wasn't told that personally to move my body. It was more that because I was younger, I was active. And so I would tell my doctor about it. And he would say, all right, keep doing it then. That's amazing. But I feel like that's not talked about enough. And I remember that when I would feel the most fatigue, I would think I can't get out of bed. But when I would
Mhm.
force myself to be active, that's when the fatigue would like really lessen. And so I love that you brought that up because that's such a core thing in my life where I'm like, oh, fatigue, let's move our body. But so many people don't know that. So I love that you mentioned that. I think that's such an amazing point. And same thing with the fatigue. I noticed that I always thought that it was just movement and nutrition that kind of contributed to me feeling less fatigue. But that's such a good point that also that if you are more positive, I feel like you're also not fighting against what you're feeling so much. You're just so
Mhm.
positive that you're letting be that I feel like that also probably doesn't take up as much energy as feeling frustrated and stressed and kind of, having more inflammation in your body in that way.
And the acceptance behind it, right? Accepting what your body's going through and knowing, okay, it's
Yeah.
okay for me to feel this way. I'm going through something really, really tough. And having that positive attitude and giving that self-care actually in a reverse way kind of helps with things. Whereas if you notice each and
Yeah.
every side effect that happens and you're down on yourself about it, that can only exacerbate it and make it worse a lot of times.
Yeah. No, such an amazing point. Yeah. I love that. I feel like I've really witnessed that in my own journey as well. So I know that you've also seen countless patients like over the years, each with different challenges, different triumphs. Are there any like small habits or ways of thinking that you've noticed make a real difference in how they heal? Like any particular things you've seen?
I think a couple of things. I mean, one is, of course, just having a positive attitude that I'm just going to get through this. Two, taking it day by day, right? Understanding that the way that you feel like today will not be the way you feel like tomorrow. If you do have a hard day, not not beating yourself down for it, not assuming that that's how the next day is going to go, but saying, okay, today was a rough day, tomorrow will be better. And so really taking one step at a time is one thing. Having that positive attitude is the second thing. Again, for the patients that are more local and are thinking about a curative intent, knowing that this is this will end, right? There's an end here. And so we have to kind of get through each step. But even again, for our metastatic ladies to think, okay, I have so many options, right? There's so many tools. And I like to say there's so many tools that we have in our toolkit. And by the time we use one tool, that could be years on that one, using that one tool. And by that time, five more tools might show up in the toolkit. And so it's kind of being really attuned to the fact that there are all these medical advancements and we're able to benefit from it. And even like two-thirds through your treatment, you'll notice, okay, something new has popped up for the adjuvant setting that wasn't there before. So I think one, positive attitude, taking one day at a time, three, knowing an end is in sight in some capacity, and four, just understanding and being and having that gratitude that, okay, medicine is consistently changing, and the things that are available to me are the prime of technology and medical advancement at this juncture, but something better might be coming out 3 months from now, and I will be benefiting from that as well. So I think a couple
Yeah.
of these perspectives can really help.
Yeah, I love that. I love that it's like these four attainable steps that you pointed out. I especially love the one about taking it day by day. I remember during my treatment, I feel like the only way I got through it, especially like chemotherapy, which was like months long, was I'm going to take this one step at a time. That is the only way I'm going to survive this. And I realized that taking it moment by moment really helped because exactly what you said. There was times where it was so hard where it was like, oh my God, if this is the rest of the next few months, I cannot do this. But then the next moment was better. And it's like, oh, wait, actually, if it's like this, I'll be okay. And so I love that there's that perspective of let's just take it moment by moment. Let's just be present in our journeys because that's also the only thing we actually can do. Thinking
Mhm,
about something 3 months in advance actually won't help us. It won't help us feel better. I've tried it, have not succeeded at
mhm,
all, and so might as well take it moment by moment. So I really love that you kind of honed in on that point.
mhm. And I
I
think
love
maybe
that.
you can appreciate too when it's like different pieces of treatment, when it's like ACT, for example. So it's, you're getting through the AC component and you're like, okay, this is tough, but there's only 4 cycles of these. And, but then and you can say, okay, just push past the next one, push past the next one. And then, when you get to the Taxol component, you can say, okay, well, this is weekly light doses. And, now I'm like one-fourth through, halfway through and whatnot. I think just at each juncture almost tricking yourself that okay, we're getting through the hard part and it'll be over. So I think that also, that kind of mindset and tricking yourself in a positive way is helpful as well.
Yeah, definitely. I always say that positive delusion is the way to live your life.
Hmm.
So I love that. So I know many people watching tonight might be in the middle of uncertainty. Maybe they're waiting for results. Maybe you're waiting for just, maybe you're navigating your treatment or just trying to find your footing again. For someone in that space right now, what kind of message of hope would you want them to hear tonight?
I think it's kind of what I just indicated as, advancement is happening all the time. So it's interesting in my clinics how I can say, okay, this is how we used to do things 5 years ago, but now we do things in this totally different way. I prescribe medications that I say, okay, this just got FDA approved in September of last year, right? So it's knowing that, okay, there are in each step you are better off right now than if you had gotten this diagnosis a decade ago, right? Having that
Yeah.
hope. And if you are at a crossroads, knowing that that advancement is still ongoing. People are working tirelessly every day for that. Our San Antonio Breast Conference is literally a month away, where more and more data will probably come out that will change the way I practice in January, right? So it's having that hope and just trying to, I know it's tough, but when there's two outcomes, one being things are not going to go well, and the other being things are going to go well. I mean, it's tough to say, but it's always going to just make it easier to assume that it's going to go well because, there's kind of four ways it can go. You assume it's going to go well and it goes well, and that's the best, right? You assume it's going to go well and it doesn't, well, then you've at least not worried yourself this entire time. And then when it doesn't, you can cross that bridge when you get there. But if you assume it's not going to go well, then you're just kind of ridding yourself of that joy in the moment. And it doesn't really change the outcome in some ways. So it's always better and more hopeful to think about the positive and hoping for the positive.
Yeah, and I feel like by also doing that, we end up becoming so resilient, right? It's like there's things that are happening, and it's very easy to kind of cave and be like, I'm just going to react to this moment and be like, this is the worst thing. And I think that's almost, it sounds silly, but it sounds like it's like almost the easy way out versus if we're doing the harder thing by thinking long term and being like, I'm going to be resilient, I'm going to take it moment by moment. It really kind of builds that strength, that builds that resilience to where the fact if even if the outcome is not as good as we wanted it to be, we built so much resilience on those months leading up to it that we also handle that news better. And I felt like every single time that happened to me where I got another piece of bad news per se, I was so much stronger than just a few months before that because I was like kind of practicing that gratitude, making sure that I looked at the positive, that I was like, okay, well, I can handle this. I already did this. I'll just do it again. And so I kind of love that you said that because it's like you'll always benefit in some way if you have that positive mindset.
Definitely.
I love that. So, something that I wanted to definitely talk to you about was because you're an oncologist, was that in my own journey, the relationship I had with my oncologist mattered a ton. It gave me so much peace when everything else was feeling unpredictable. And when I was going through that hard time, I feel like I just really needed that one person to lean on. And I feel like that relationship really impacted it. And so, if someone's feeling intimidated or maybe emotionally overwhelmed with their appointments or their relationship, how can they build that open, trusting partnership with their medical team?
Yeah, I think there's a couple of things. I mean, first is obviously open communication, and trusting and verifying, right? So I never mind, and I don't think any physician or provider will ever mind someone asking, what are the percentages, or what study did that come from? What did this look like a year ago? Has there been advancements? Are there any clinical trials? Making sure that you're trusting what they're saying is also verifying it yourself a little bit, right? Making sure that you're like, okay, I know if I went to 10 other providers in this field, they would all say the same thing. Knowing that and having confidence in that, whether that is getting a second opinion if you wanted it, just to say, okay, I can concur that this is the best plan for me because everyone agrees this is what standard of care is. And I want people to have that confidence and trust, because if you don't trust what someone's saying, then you're never going to be able to establish that great relationship. So whether it is asking the questions, asking for the studies yourself, asking, hey, is there someone you would recommend for a second opinion? Not because I don't trust you, just because I want to verify, making sure you have utmost and full confidence in the plan. Because once you're able to say, okay, I trust what this person is telling me, I'm confident in it, then you don't have to think, right? And then once you don't have to think, you can just be the patient, right? It's really hard to be both an advocate and a researcher and a scientist and a physician and also a patient, right? And so I think it's from the beginning, having those goals, and knowing, okay, I can trust that person, communicating with them, telling them your thoughts, your fears, your emotions, right? Because they understand this is what they've chosen to do for a living, and this is these are, they're dealing with cancer patients all day, every day. So they maybe haven't experienced the emotions themselves, but are very attuned to these emotions. And asking for resources and support in the community as well, whether that's like we talked about, a psychologist, if you feel like that'll be a source of support, a dietitian, if that's a source of support, if you have financial restrictions like, hey, is there a financial advocate? Are there grants available? So making sure that it's not just this one person that becomes your everything, but you feel like you are well supported and cocooned by an entire team that's working towards your benefit. So I think having that relationship up front, not being fearful, like, okay, this is a provider and I can't express my fears and express my emotions or express anything, and that's something that's going to be reserved and saved for my family and friends. Um, that's just doing a detriment to yourself because you want to be able to go and open up and be very vulnerable to that provider. And I think in order to do that, you need to trust their plan at first. And so whatever research that needs to be done in order to get there, once you trust that plan, kind of going in with it and opening yourself up to that, I think is the most important thing. And it's also on the provider, right? If they're not providing a supportive network, or you don't feel that rapport with them, it's okay to say, okay, I trust that they would be great for their patients, but maybe this is not the person for me, right? And I
Right.
think in most places, thankfully, we have options, right? And so I never mind if someone chooses a different provider than me or vice versa, right? We just want everyone to feel comfortable because it's such a stressful journey and emotional journey that you want to feel like this person has your back and is your best advocate possible.
Yeah, definitely. I love that you said that it's really important to just have that trust and to properly be a patient. Because I remember going through that and being like, I'm trying to play patient, but I'm also trying to play doctor with myself on Google. And so, like, I know that at some point when I would go to like my oncologist, my husband was very big on being like on Googling every symptom.
Hmm.
And my oncologist would be like, man, you just need to stay off of Google, like, and so
Yeah,
like sometimes that's just like the truth of the matter. And I love that you said that because I think it's important to just be a patient. And that's where we can take control. We can allow ourselves to just have that trust, play that role so that we can focus on healing versus also trying to diagnose ourselves at all times. Because that gets super exhausting and absolutely has contributed to fatigue for me, at least in the past.
it gets super exhausting, and it I've been there myself in fields that are not oncology, right? When you're a patient for something else. And you have to, sometimes I have to remind myself, okay, I'm going to be the family member, or I'm going to be the patient, and let the provider do their job, right?
Yeah.
And so I have to take that personal step back when it's not oncology. So I understand how tough it can be, but it is hard to dig through the data when it's not something you do for a living. I'll have a patient be like, "Oh, I learned about this new drug." And I'll be like, "Actually, that's really exciting. I agree, but that's for HER2 positive disease, and you have like hormone receptor positive disease, right?" And so it's and HER2 negative, right? So it's one of those things that I'm like, I promise you, if there's an update, I learn about it, I research it, I know about it, I will recommend it for you. You don't need to be on all these blogs and websites and things trying to search for it, because that's exhausting, right? You need to just focus on being the patient. I understand the temptation, but that's when I say, okay, if you're not trusting that doctor, then go ahead and get a second opinion, but don't cheat yourself out of, just being able to relax and be the patient and having to do this chasing yourself, because that'll just be very exhausting for you.
Exactly. Yeah. No, I love that advice. And I love that that's something that we can take away as patients and being like, okay, all right, let's just breathe. Let's just put that trust in so that we can actually have less fatigue at the end of the cycle. So I
Mhm.
love that so much. So this has been such a powerful conversation. I think it's touched so many of our hearts. It's absolutely touched mine. I want to maybe just leave us with maybe one final takeaway. And so just something that sums up your entire philosophy on healing. What would that be?
Uh, Hope, and faith and positivity. I know that's not one word, but trust and hope in the process, faith that it'll all work out, and positivity that no matter what, you'll get through it. And I know it's hard. I see it all the time, but we get people through, we get all our patients through. So just having that hope and faith.
Yeah. Thank you so much for being here. This was seriously so wonderful. I feel like I learned so much, and I love that there was just so much about mindset and gratitude and being able to truly do what we can, bringing in that positive mindset, bringing in that aspect of being that patient, taking on the roles that we need to take on so that we can actually truly relax, so that we can truly feel better. And it was just very reassuring to know that so many of these things are research backed, that mindset, that gratitude, and all these things do play such a big role, and that you do see that daily. I think that was very important for me to hear, because not just because I've seen it firsthand. I think that sometimes we forget as human beings. So to relearn that and re-remember, wow, like this is actually the answer in these situations, I think was so powerful. So thank you so much for being here.
Of course. Thanks for always sharing your story and being so inspirational.
Thank you so much. Okay, so now I want us to just do a little bit of meditation, kind of hone in so you have another kind of practice to take home with you. And then we'll end this and hopefully just continue this journey of gratitude and healing. So I'm going to have all of us actually close our eyes again. And I want us to just take a few deep breaths again. So let's inhale and exhale. Inhale and exhale. I want us to just still our bodies and get into a pose that feels very comfortable for us so we can sit for a few minutes together. I want you to keep your eye focus in between your eyebrows while you're closing them. I want you to think of a calming word or phrase that truly resonates with you. And I want you to repeat that, not out loud, but within, as you continue to gaze in front of you with your eyes closed. As you repeat this calming phrase or word, allow yourself to just focus on that. And if any other thoughts come in, just allow yourself to gently come back to gazing and repeating that calming word or phrase. Let's sit together for about a couple of minutes, and I will let you know when we're done. I want you to gently come back. So I know that some of you may have had some questions for Dr. Hemrajani, and we were only able to get through a few today. So if you do have any other questions, I'd love for you to put it in the chat, or you can email me afterwards. I'll put my email in the chat in just 1 second. And I will get those answers for you from her afterwards, and I'll email it to you just in case you had some questions that were really on your mind. But otherwise, if you would like to talk any further, please feel free to send me an email. you want to ever have any coaching or if you want to join any other wellness talks in the future, then I will definitely keep you updated. Did send my email address in the chat. I hope that all of us can remember to just practice gratitude, to have that positive mindset. Even if we forget it sometimes, remembering, oh, actually, this is who we really are, knowing that all of us are capable of being positive, choosing to see the gratitude and seeing the best in things, knowing that we have that inner strength and resilience within. None of us are different. We all have that capability. It's just about honing it in and practicing it as much as possible. So I hope that this talk was helpful. I hope that you can take the practice of gratitude, taking the practice of reframing, taking that practice of stillness and meditating when things feel overwhelming so that you can find that strength and find that peace within. Thank you all so much. I'll stay on for a couple more minutes just in case any of you want to type in your questions. But otherwise, feel free to email me, reach out in the future. And I'm just so glad that we were able to spend this night together. Thank you, everyone.